All right. So today we start with the cranial bones, and the very first bone that we will be dealing with is obviously the mandible. Now, just a little disclaimer here. Whenever we are studying anatomy and obviously practical things like these, it's always best to study from the real practical model, the real bones. But in this case, since my bone set has been left out in my medical hometown, and I have been locked out here in my own hometown, so I have to make a compromise here and study, or rather teach, from this 3D model here. But I feel like this is quite accurate as well. So I think this model will suffice. However, obviously the best thing to study from is the bone, the real bone itself. So if you have a bone, please do hold it out and keep on track with whatever I will try to speak on here. It's a pretty easy bone considering the other cranial bones. The mandible is quite easy. But okay, let's get on with the very first basic things about the mandible, and then we will obviously be dealing with the little more advanced things. It's a very easy thing. It's a very easy bone, nothing to worry about. So firstly, the mandible. It's also known as the jawbone. Obviously, that's a very popular nomenclature. There's a common nomenclature, in fact. Now, this jawbone, it's actually divided into two parts. All right, two parts. What you're seeing right now is the anterior view of the mandible, right? Mandible is a bone that is very easy to visualize because you see, whenever we see a skull, we think of a mandible, right? We think of a mandible. So it's very, very easy to visualize. So if I show the real thing here, see, this here is a mandible. Pretty easy to visualize. If I had been talking about a bone like, suppose the sphenoid or the ethmoid, then it would have been quite difficult to visualize because we do not really see these bones as such. But mandible is very easy to visualize, and hence it's pretty easy too. Anyways, so let's get on with the basics, obviously. And the very first thing about the mandible is, which I was talking about, is that it is divided into two parts. All right, two parts. If we look at this mandible, this is the lateral view, we will see that, these are two processes that the mandible has, and this right here up to this is one part of the mandible. All right, whereas this whole curved part, this whole curved part, this whole curved part, this is the second part of the mandible. So let me get this straight for you guys. The mandible has two parts. One is this flat rectangular bony plate like parts on both sides. This is the second side, this is the first side, and the other part is this curved part. All right, these rectangular bony plates of the mandible, they are known as what we call to be the ramus of the mandible. All right, so these rectangular plates, they are the ramus or the rami in plural of the mandible. And what about this curved part? What about this curved part here? This curved part is what we call to be the body of the mandible. So the mandible has these two parts, that is the ramus of the mandible and the body of the mandible. All right. All right. Now, listen to me very carefully. We will be dealing mandible in a systematic order. How? We are going to first talk about the body of the mandible and the general features that it has, and all the surfaces that it has, all the borders that it has, all the muscle attachments that it has, all the nerves and vessels related to it, and all stuff related to the body of the mandible first. Then we will talk about the rami of the mandible. All right, very well. So let's talk about the body of the mandible. Now, body of the mandible, the first thing that we can tell about or rather comment about the body of the mandible is that this is the external surface of the body of the mandible, and this is the internal surface of the body of the mandible. All right. So an external surface and an internal surface. All right. These are the two surfaces of the mandible. Now, what about the borders of the body of the mandible? This is the upper border of the body of the mandible. This is the lower border. Let me give you a better view. This is the lower border of the body of the mandible. We are not talking about the rami right now. All right. Although we can talk about the rami and tell about its surfaces and stuff, but let's deal with this systematically. Let's get on with the body first. So the body has this external surface and internal surface, this upper border and a lower border, right? This upper border, you can see that there are, these holes here. I feel like you can already tell what these holes are meant to be. Yes, these are sockets. These are actually meant for the teeth, for the dentation. Since the mandible is a jawbone, so it also holds the teeth in the lower jaw. So the upper border of the body of the mandible, this is actually holding the teeth. Now this border is also known as a very important name. Please note this down. Also known as the alveolar border. Alveolar border. All right. Now, what about this lower border here? What about it? This lower, let me give you a better view. Yes, this lower border, this is known as the base of the mandible, or rather the base of the body of the mandible. All right, very good. So far so good. Now let's get on with the little more complicated things. Now look very closely. I know this is difficult because this is not the real bone itself, and since firstly this is an application, a 3D rendering of this same thing, and secondly you won't be able to feel it if you don't have the real bone, but still a very faint midline structure here can be seen. All right, very faint. It's quite faint actually, but this faint I would say line in the midline of the body of the mandible, this is known as symphysis menti. All right, symphysis menti. Now let me tell you something. This symphysis menti, it's actually what is this actually? Firstly, let me define that for you. Symphysis menti is actually denoting the location of the junction of the two halves of the mandible. If we study the development of mandible, which we will not in a detailed manner, we will not do that, but it will suffice for us to know that the mandible is actually formed from two halves of the bone joining together in the midline. This midline, along which the two halves of the mandible join, is known as the symphysis menti. Now, we have learned about symphysis, this word. We have learned about a structure called symphysis pubis as well. That was a cartilaginous joint actually. Symphysis menti, is it a cartilaginous joint? No, it is not. This is a very important thing. Please note it down, jot it down, embed this in your head. Symphysis menti is not a cartilaginous joint. It is a fibrous tissue. At the initial days, it's a fibrous tissue. Later, these two halves join and this faint line remains. That is symphysis menti. So why the name symphysis then? If it's not a cartilaginous joint, then why the name symphysis? It's actually, very frankly speaking, it's a misnomer. It should not have been named a symphysis. The reason why it was named symphysis is because it's a midline structure. When we compare it to the body, this is a midline structure, the middle of the jaw, the middle of the body. Hence, it is known as symphysis menti. All right. Now, this symphysis menti, this midline structure, it reaches towards the base, and there it will meet. Here also it's very faint, but I will still implore you to look at it very carefully and try to notice this thing. A triangular protuberance. This is something which is, I don't know whether the lateral view will do it any good, but can you see this elevation here? This is actually a triangular structure and located near the base. This triangular protuberance of the mandible is known as the mental protuberance. So the symphysis menti reaches the mental protuberance towards the base. All right? Right. Now, this mental protuberance also leads to another structure inferolaterally. These structures, which is led on by the mental protuberance, is the mental tubercle. All right, that is the mental tubercle. So first we have the symphysis menti, then we have the mental protuberance, then we have the mental tubercles. All right, so far so good, I feel like. Okay, so now let's move on. All right, the next very important structure which you yourself can make out, even in this app you can make this out, is this thing here. Can you make out this hole here? Yes, it's a hole. It's a foramen. This foramen is known as the mental foramen. It's a very important structure and I will tell you why. I'll explain it to you. But for the time being, you have to remember its name. That is the mental foramen. What is the location of this mental foramen, by the way? Obviously, it is located on the external surface or the exterior of the body of the mandible. But we need a little more precision, obviously. So, to be more precise, its location is very important. Please note it down. Between the first and second premolars. The first and second premolars are these two sockets here. These last three are the molars. These two are the premolars. This is one canine. These four are incisor. Again, we have a canine. Again, we have two premolars. And again, we have three molars. That is the dentation. Very easy, we know that. So between the two premolars, the first and second premolars, at the same line, we have the mental foramen. Here in this app, it's a bit misplaced, a little bit too lateral, but okay, I think it would suffice. So between these two first and second premolars, we have this mental foramen along the same line. All right. Now, when we will be studying about the cranial bones, since this is the first cranial bone that we are exploring, when we will deal with the more complicated ones, we will see that almost all cranial bones have these foramen, have these holes and these foramen. And what's the purpose of these foramen? The purpose of these foramen is very important. Not only this mental foramen that I'm talking about here, but all foramina that we will find in mandible and all other cranial bones are very important, because different cranial nerves and vessels will pass through them. So they are acting as a passage for the different structures. So they are very important. So mental foramen also is no exception to that. Mental foramen is also no exception to that. So mental foramen will also allow the passage of some structure. Now what can that structure be? The name of the foramen is mental foramen. So the name of the structures passing through this mental foramen, what can they be? Yeah, very simple. Mental nerve and mental vessels. As simple as that. So the mental foramen is giving passage to mental nerve and mental vessels. All right. And where is it located? Just as I said, between the first and second premolars. Repeating information means that information is important and worth embedding. So if I repeat something, that only means that I'm stressing on that, emphasizing on that. Between these two first and second premolars, we find the mental foramen, and it gives passage to the mental nerve and vessels. All right. All right. All right. Look very closely. See, I had said that this is the ramus of the mandible. We have not gone into the details, obviously, but this is the ramus of the mandible. This is the anterior border of the ramus. All right, that is pretty self-explanatory because this is anteriorly facing. So the anterior border. This anterior border, if you look closely enough, you will find that this anterior border is kind of continuing as an oblique line here. All right. I don't know how visible this is. It's pretty faint, but trust me for now when I say that this anterior border actually is continuing as an oblique line over the external surface of the body of the mandible. This oblique line is very important. Why it's very important is because it actually serves as a place, or rather line of origin or attachment, if you may, to different muscles. And in when we are studying about head and neck, muscles are of utmost importance because every muscle is very minute, related to different functions, and it's very important to know about their attachments. I know it can be pretty dull sometimes to remember all of that. It can be pretty stressful, but that's the reason why we study head and neck at the very end of anatomy, when we have already covered up most of the things of anatomy. That is when we study head, neck, and brain, neuroanatomy. Anyways, so this oblique line that we find, it serves as a line of attachment to different muscles. Now, try to keep up with me when I say the name of the muscles and where they are attached along the oblique line. All right, listen very closely. You see, since this oblique line is kind of progressing from posterior to anterior, so it will have an anterior part and a posterior part, right? It will have a posterior part here and an anterior part as it progresses, right? Now, the anterior part of the oblique line, which is corresponding to the premolars here, the two premolars here, corresponding to that, the part of the oblique line that actually gives attachment to two muscles. What are those two muscles? Depressor labia inferioris and depressor angularis. Two muscles. If you are studying for the first time this head and neck part and the muscles, then obviously these are new names, but with time obviously we will get familiarized with all the muscles of the head and neck. So for now you have to bear on with the new names. So it's kind of an introduction. Like I'm introducing you to two muscles. What are those two muscles? Meet depressor labia inferioris and depressor anterioris. Where are they attached? They are attached along the oblique line corresponding to the two premolars. That is the anterior part of the oblique line. Right? Right. But I said that there is a posterior part of the oblique line also. So there must be some muscle which is attached to the oblique line along the last three molars as well. That muscle is very important. Remember this name, buccinator. Buccinator is a very important muscle, and when we will be studying about the face muscles and the face as a whole, we will see that how important this muscle is. So for now, since we are more concerned about the osteology and mandible as a whole, so we will just leave it to that this oblique line is actually providing attachment to buccinator along the last three molars. And actually what happens is the buccinator's attachment goes beyond this third molar. So it's not just up to the oblique line, it actually even goes beyond, somewhere over here. All right, this information will come in handy just a few minutes later. All right, so now we need to learn about two more muscles. What are those two more muscles? All right, do you remember what these are? These are teeth, the sockets, obviously. These front ones, they are the incisors, right? This 1, 2, 3, 4. These four are the incisor. Between the incisors, we have what we call to be a fossa. You can kind of make it out if I'm trying to find the right view. See, laterally it is kind of visible. These are fossa, small fossa between the incisors, right? These are known as the incisive fossa. All right, the incisive fossa. Why is this knowledge necessary? This knowledge is necessary because this part of the incisor, that is the incisive fossa here, these will also provide attachment to two muscles. What are they? First is the fused lips of orbicularis oris. Orbicularis oris. And the second attachment is mentalis. So both of these, they are the name of two muscles, and obviously we will be dealing with their details and we'll get to know them better when we study about the face as a whole. But again, I'm telling that for now this will suffice. So for now it's kind of like mugging up, we cannot help it, but the more we will deal with their actions, it will become easier, I feel like. So the incisive fossa is providing attachment to the two muscles, that is the fused lips of the muscle orbicularis oris and the muscle mentalis. So these are the two muscles, and along the oblique line we found the attachment of three muscles. Right? Right. Now we were talking about the external part of the mandible. Can we now deal with the internal part of the mandible? We can, obviously we can. Okay, but before that I just remembered something. I have left out something. Now, pay close attention, alright? You see, the oblique line, laterally it is quite visible, I feel like. This oblique line, behind the oblique line, somewhere over here, this surface of the mandible or the body of the mandible is related to two more structures, or rather three more structures if you may. What are those three more structures? Those three more structures are, firstly, the facial artery, the facial vein, and what we call to be the marginal mandibular branch of the facial nerve. It's getting very overwhelming, I can feel that, but please bear on with me. What I'm telling, I'm repeating it again. It's not that difficult. See, these are just like puzzles and jigsaw puzzles, all right? These are just like the puzzle pieces. At the very beginning, when we start solving the puzzle, we kind of randomly pick up a puzzle piece and fit it somewhere. Later on, when we are kind of building on towards something, that is when the picture starts becoming clearer. So this is the initial piece of the jumble puzzle, right? So for now, it will not make that much of a sense, if you may. So it will seem like mugging up and stuff, but it will make sense. So for now, please bear on. Don't let your brain get overwhelmed. Behind the oblique line, this part is related to the facial artery, the facial vein, that is the facial vessels, and another nerve. What is that nerve? That nerve is facial nerve. Firstly, remember facial nerve, right? Then remember that it's not facial nerve, it's actually a branch of facial nerve, right? Now recollect that it's what branch of facial nerve? Yes, the marginal, since we are talking about a margin here, marginal mandibular, because we're talking about the mandible here, branch of the facial nerve. So facial vessels and the marginal mandibular branch of the facial nerve. By the way, a very interesting information is this facial artery is tortuous. It's not a straight artery, but we'll deal with that later. So that is something that I was wanting to get out of. And now we can finally get in the interior part of the body of the mandible. Now, what we are looking at is the internal surface of the mandible, right? So this is the internal part of the body of the mandible, and these are the obviously the interior parts of the rami of the mandible. As far as the body is concerned, now listen to me carefully. You see, we talked about the symphysis menti, right? But we talked about the symphysis menti only from the external surface. It also has this internal part also, right? It also has the internal part, right? Why I am telling about symphysis menti is because here it is not at all visible, but yeah, it's not visible at all. So if you have a practical bone with you, an original bone if you may, then I feel like it will be much clearer to you. But this internal part of the body related to symphysis menti, this is actually related to, or this actually has what we call to be 4 spines, all right? 4 spines or spine-like structures, also called 4 tubercles, all right? These 4 tubercles or spines, they are kind of placed like 2 above and 2 below, all right? 2 above and 2 below. That's how they are placed. Why I am telling this is obviously because it has some kind of a correlation with what we are going to talk about and the more important things. That correlation is that the 2 spines or tubercles located above, they are called the superior genial spines, and the 2 spines located below are known as the inferior genial spines or tubercles also. These superior genial spines, they are providing attachment to an important muscle which is known as genioglossus. genioglossus, whereas the inferior genial spines, they provide attachment to geniohyoid muscle. So genioglossus and geniohyoid, and the spines are known as the superior genial spines and the inferior genial spines. Genial. I feel like this is the spelling. All right. So a quick memory aid here. You see, genioglossus. Glossus is starting with G, and geniohyoid H, right? So G is above H. G comes before H. So just like that, genioglossus attachment is above geniohyoid attachment. All right. That's I feel like a quick memory aid, if you may. But now let's get on with the more important structure, which we can kind of trace out in the interior or the internal surface of the body of the mandible. Now, see, we talked about the oblique line externally, right? We talked about this external oblique line. This was located externally. Just like the oblique line externally, we also have a line internally as well. All right. We also have a line in the internal surface of the body. All right. Now this is actually starting from, or rather running from, the lower part of the symphysis menti. The lower part of the symphysis menti somewhere here. Now this oblique line is again not very clearly demarcated here. Yeah, it's not very clearly demarcated, but we will have to assume that it is there. All right. It's not difficult to make that out in the real model, so that is why I'm going on with this 3D model. Anyways, so this oblique line, which is located, or rather which is running from below the interior part of the symphysis menti to, what is this? The third molar, right? Towards the third molar. This line is known as the myelohyoid line. The myelohyoid line. Very important structure. See, it's kind of just like we studied about the oblique line externally. There is also another line internally, and that is known as the myelohyoid line, which is running from below the internal part of the symphysis menti to the third molar here, somewhat like this. All right. Why I'm stressing on the myelohyoid line? Again, there must be some reason, obviously. The reason is very simple. The reason is, again, just like the oblique line, this myelohyoid line also provides attachment to muscles. Very simple. What muscle? Myelohyoid line provides attachment to myelohyoid muscle. So it's very easy. The name myelohyoid, you remember that, you recall that, and it's serving as a dual purpose. It is the name of both the line and the muscle attached to it. So it's pretty easy, right? But then again, it is not the only muscle which is attached to the myelohyoid. Just like the oblique line had that anterior part and the posterior part, myelohyoid line also has an anterior part and the posterior part. So the anterior part is related to the myelohyoid muscle, but the posterior part, which is close to the third molar, that is related to another muscle. That is known as the superior constrictor muscle. Very important. All right. So the superior constrictor muscle, that is related to the myelohyoid line posteriorly, whereas the myelohyoid muscle is related anteriorly. Now, I had told you to remember something very important. Obviously, everything that I'm talking about is important, but I had told you to pay close attention to something which will come into usefulness later. Do you recall that? Yes, very, very good. This oblique line, I had said that posteriorly it was giving attachment to the buccinator. But I had also told that buccinator's attachment is extending and it is kind of going on to this place here. That is behind the third molar. Behind the third molar. Now, the buccinator is coming from the external part to this part, whereas the superior constrictor is also moving from internal part to behind the third molar because of its attachment to the posterior part of the mylohyoid line. What happens is that there is an interlacement of the muscle fibers of these two muscles. Very important concept. There is an interlacement of the muscle fibers of buccinator coming from external and the superior constrictor coming from the internal surfaces of the body of the mandible due to their attachment to the different lines. Oblique line in case of buccinator, mylohyoid line in case of the superior constrictor. This interlacement of fibers is giving rise to what we call to be a raphe. A raphe. The name of the raphe is pterygomandibular raphe. Pterygo, P-T-E-R-Y-G-O, I feel like, yeah, pterygo mandibular raphe. All right, very important. Please do try to remember this. And by the way, I'm showing all of this on the left side, but that does not mean that the right side is deprived of all this. These are symmetrical things. So obviously, whatever I'm telling on one side of the mandible is reflected on the right side as well. All right, now let's talk about something else. We were talking about the mylohyoid line, right? It is somewhere here like this. It will go, right? Right. Now there are two more important structures which I would like you to remember, and they're very important, and you already know about these structures. Like whatever I was talking about, like buccinator, superior constrictor, or the marginal mandibular branch of facial. Right, it might seem overwhelming because you are not, or neither of us are very accustomed to these kinds of terms. But what I will be dealing with just now is quite common and quite popular. That is the salivary gland. Yes, you see, there were three salivary glands major. There was the parotid gland, there was a submandibular gland, and the sublingual gland. The sublingual and the submandibular gland are related to the interior part of the body of the mandible. How so? Very simple. You see, the mylohyoid line, above the mylohyoid line, somewhere over here, we have a fossa, which is the sublingual fossa. This sublingual fossa is lodging the sublingual salivary gland, right? That is why it is sublingual, because your tongue will be somewhere over here above, and sub means below. So just below the tongue, over somewhere here, you will have the sublingual fossa, which will be lodging obviously the sublingual salivary gland. All right, and that is obviously above the mylohyoid line. All right, that will be above the mylohyoid line, whereas the submandibular fossa, that will be below the mylohyoid line, somewhere over here. So below the mylohyoid line, which is actually running from the internal part of the symphysis menti to the third molar tooth, below that mylohyoid line, somewhere over here, we will have the submandibular fossa lodging the submandibular salivary gland. Very simple. Now, just a few minor things related to the body of the mandible remain. That is, firstly, all right, the mylohyoid line, it is somewhat running like this, right? I'm telling this for the 586th time. It is running somewhat like this. Between the mylohyoid line, the posterior part of the mylohyoid line, and the third molar, this part of the interior surface of the body of the mandible is related to a structure. That structure is the lingual nerve. Very, very important. The lingual nerve. So, what we are talking about, again, it might seem overwhelming, but no, it is not. Please, please, cool and listen to me carefully. Between the third molar and the posterior most part of the mylohyoid line, there is some surface left of the body of the mandible. That part is related to the lingual nerve. So this part, which was behind the oblique line, was related to the marginal mandibular branch of the facial nerve and the tortuous facial artery and vein. And this part between the mylohyoid line and the third molar tooth, that is related to the lingual nerve. All right. Now I feel like I am safe to say that I have completed about the body. Oh no, we have something else left. The base of the body. This is just it's not much. There's nothing much to learn about this. It's just that the base of the body of the mandible, obviously, this has an important attachment. What it has attachment to? It has attachment to what we call to be the investing layer of the deep cervical fascia. The deep cervical fascia, investing layer of the deep cervical fascia of the neck. All right. We know that the neck is one of the structures of the body where deep fascia is actually present. All right. So investing layer of the deep cervical fascia, obviously we will be learning about this in detail when we will be studying about the neck itself and not about the mandible like we are studying now. And another attachment is there. Another attachment is the platysma muscle. The platysma muscle, that muscle's attachment is superficial to the attachment of the investing layer of the deep cervical fascia. So what I'm telling about, let me repeat it again. Both the investing layer of deep cervical fascia and the platysma muscle, both of them have attachments to the base of the mandible. But the difference is that platysma's insertion is more superficial and deep cervical, so it is deep already. There is already a hint in the name that is deep cervical fascia, investing layer of the deep cervical fascia. So that is deeper and not superficial. But both of them have actually attachments to this base. All right, very good. Another important thing about the base, which I forgot to mention, is, again, it's not very visible here, but you will have to bear with me in knowing that there are two fossa over the anterior part of the base. See, the base is curved, U-shape it, right? So it obviously has these posterior parts and here these anterior part. So the anterior most part of the base of the mandible, somewhat the chin, you can say the chin, this has two fossa. All right, these fossa are known as the digastric fossa. Digastric fossa. Why so? Because they provide attachment to the anterior belly of the digastric muscle. Again, something which we will be covering in detail later. All right. So the digastric fossa, and it is providing attachment to the anterior belly of the digastric muscle. And how many fossa are there? How many digastric fossa? Two. digastric fossa. See, the hint is already there in the name, there is two. So two digastric fossa are there in the anterior most part of the base of the mandible. All right. Now let's talk about the rami of the mandible. See, these rami of the mandible, they are rectangular plates, rectangular plate-like structures, right? So let's quickly look at their gross anatomical demarcations, like what are the surfaces, what are the borders and stuff. See, mandible is very easy. Why? Because pretty much everything is very symmetrical. And even more, the fact which actually counts more is the fact that everything is very well demarcated. In many cranial bones, we will not be as lucky as we are with mandible. So it's pretty easy to understand mandible. That's why we start with it. Anyways, so this rectangular plate, this is what we call to be the rami of the mandible. All right. Rami is plural, obviously, because there are two ramus. Now, this is obviously what we call to be the external part of the ramus, or more precisely, this is the lateral surface of the rami, because you see anteriorly, obviously, this is laterally located. So this is the lateral surface. This is also the lateral surface. This is the medial surface. This is the medial surface. This is also the medial surface. All right. So the lateral surface and the medial surfaces. And what about the border? So as far as border is concerned, we have the superior border like this, the superior border. We have the anterior border. We have a posterior border. And we also have this inferior border, which is the base actually, which is also known as the base. All right. All right. Now, having talked about the gross anatomical features of the rami, let's quickly talk about the external part, or the lateral surface, if you may. It's not actually known as the exterior part, like the body of the mandible was, but it's known as the lateral surface of the ramus. All right. So the lateral surface of the ramus, firstly, we have to know the muscle which is attached to the lateral surface of the ramus. Very famous muscle. This muscle is known as the masseter muscle. Masseter is a very, I would say, important muscle. But now, since I have said that for almost all the muscles which are attached, so for the sake of novelty, I would say that masseter is a very unique muscle, in the sense that it is one of the strongest muscles of the body. Masseter is one of the strongest muscles of the body, and it is primarily concerned with the chewing. All right. All right. So the lateral surface, almost the entire lateral surface of the rami of the mandible, is related to or provides attachment to the masseter muscle. However, posterior-superiorly, that is posteriorly and superiorly, posterior-superiorly, this part is not really related to the masseter, but is related to another salivary gland, that is, yes, parotid gland. We talked about the sublingual, submandibular, somewhat over here, and now we are talking about the parotid gland, which is actually related to the posterior superior part of the ramus of the mandible. Right? Right. Now, let's talk about the internal surface of the rami of the mandible, or ramus of the mandible. See, the internal surface, the very first thing that you would notice is this very huge hole, if you may. A very huge hole that I obviously know that you can notice this. What is this? Here also you can see. Here also you can see. What are these holes? Obviously these are not known as holes as such. These are known as, again, foramen, right? This foramen is known as the mandibular foramen. The mandibular foramen, very important structure. Just like I have said already, that any foramen in the skull, in the cranial bones, all the foramen, they are present for a reason, right? The reason for the presence of these foramina are the passage of different structures. So again, just like we have talked about the mental foramen, this mandibular foramen also provides, rather gives passage to some structures. That structure, in case of the mandibular foramen, is known as the inferior alveolar nerve and vessels. Inferior alveolar nerve and vessels. Very important. All right. So through the mandibular foramen, the inferior alveolar nerve and vessels, they will pass through. And what is very interesting is that this mandibular foramen, which is somewhat over here, this is actually leading to a canal, right, which is known as the mandibular canal. Now the mandibular canal itself will split into this mental canal and an incisive canal. Now the nerve and vessels, that is inferior alveolar nerve and vessels, along with the canal, they will also split into the mental nerve and vessels and the incisive nerve and vessels. All right. So it's very interesting, and it's quite symmetrical also. We are not getting any random names. We are getting names according to the foramen names, like mental foramen, so mental nerve and vessels. All right. All right. So that is the mandibular foramen for you. Now, another interesting thing which you can actually locate from here is this structure. This is the mandibular foramen, but just in front of the mandibular foramen, we can see a bony process which is kind of guarding the mandibular foramen. This is known as the lingula. All right. So here also, this is the lingula. Now the lingula is actually, obviously it's lingula, so it's a tongue-like process, right? This is an important site because it provides attachment to a very important structure, that is the sphenomandibular ligament. So the lingula is providing attachment to an important structure, that is the sphenomandibular ligament. Here also, and it is a tongue-like process just related to the mandibular foramen. All right. Now let's get on with another important structure. This is quite clearly demarcated in this model. Can you see this groove here and here? Just from the mandibular foramen, there is a groove running. This is quite well demarcated in this model. I'm quite happy for that. This mylohyoid groove. So we have something called the mylohyoid line going like this, and we also have this mylohyoid groove. All right. Now, as far as the mylohyoid line was considered, it provided attachment to the mylohyoid muscle, right? But as far as the mylohyoid groove is concerned, this actually provides passage to, or it rather lodges, since it's a groove, so it lodges the mylohyoid nerve and vessels. Very important. So the muscle is attached along the mylohyoid line, whereas the nerve and vessels are lodged along the mylohyoid groove. All right. Right. Now this mandibular foramen, this is actually leading on to the mylohyoid groove. So the mylohyoid groove is actually running below and in front of the mandibular foramen towards this region, somewhat like this. And I have already said that there is a fossa over here. What is that fossa? The submandibular fossa. So we can say that the mandibular, or rather, I'm sorry, the mylohyoid groove is running towards the submandibular fossa. Right? Okay. Now, listen. See, this is the mandibular foramen. Postero-inferiorly, this part, postero-inferiorly to the mandibular foramen, this part is actually related to the attachment of an important muscle. That is the medial pterygoid muscle. Alright, so postero-inferior to the mandibular foramen, we have the insertion of, or rather attachment of, the medial pterygoid muscle, right? And this part that is behind the mandibular foramen but above it, we have a relation of an artery, that is the first part of the maxillary artery. All right, so it's kind of like postero-inferiorly and postero-superiorly. Postero-inferiorly, we have the insertion, or rather attachment, of the medial pterygoid muscle, and postero-superiorly, we have the relation of the first part of maxillary artery. In relation to what? Postero-superiorly or postero-inferiorly in relation to what? The mandibular foramen. That is what we are talking about, right? So very important. Do not get overwhelmed. Again, this is a request. Take it easily. I know there's a lot of things, but it is manageable. After dealing with the surfaces of the mandible, or rather the rami of the mandible, let's deal with the borders. The very first border that we will deal with is the superior border. This over here. This superior border, obviously you can say that this is more like a notch. So this is known as the mandibular notch, U-shaped mandibular notch, and it is also serving as a superior border of the ramus of the mandible. Now you can very clearly demarcate that there are two processes. Here one, and there is another here. These processes are known as, this posterior one is known as the condylar process, and the anterior process is known as the coronoid process. All right, so please do me a favor and do remember these two names. What is this? Very good, condylar process, and what is this? Coronoid process. So anteriorly the coronoid process, posteriorly the condylar process. And by the way, there is another relation. There are a lot of relations, I know. So that's why I'm telling that you please do take this video very slowly, if you may. Take your time with this information and try to grasp everything as much as you can, at least. The superior border, this is related to, or this is in relation to, the masseteric nerve and vessels. Masseter, just like the name of the muscle that we call over here, the entire external surface, or rather, again, it's not the external surface, it's more like the lateral surface of the ramus of the mandible is providing attachment to the masseter, important muscle. So the masseteric nerve and vessels, they are related to the superior border of the ramus of the mandible. As far as the posterior border is concerned, I had said that, parotid gland is located posterior-superiorly. Hence, a masseter is not completely attached to the entire ramus, because posterior-superiorly there was a parotid gland. So the posterior border is kind of related to the parotid gland. Now, let's talk about the processes in a little bit more detail, not too much obviously, just a little bit. Okay, so please bear with me, just a little bit. As I said that this posterior one, this is the condylar process, right? Anybody can make out the fact that this condylar process, if you see it carefully, let me get the view right. Yes, this is elliptical shaped, right? It's kind of elliptical. So that is a condylar process, right? Now, the condylar process, the elliptical part of the condylar process, that is the head of the condylar process. Whereas this constricted part of the condylar process, just below the head, is the neck of the condylar process, obviously. Why I'm telling you this? Because this is an important site of attachment of the mandible to the temporal bone. Yes, you see, the mandible is a jawbone, so obviously this is movable, right? Unlike all the other cranial bones, the uniqueness of mandible is that it is a movable bone. So obviously it has to be joined to the skull in some place. That some place of the mandible is this and this. These are the two processes which get attached to the temporal bone. We will learn more details about this when we will study about the temporal bone, but for now it's sufficing to say that these two processes are involved. All right, so the name of the joint which will be formed is the temporomandibular joint. Now the temporomandibular joint, this head of the condylar process, it is actually covered by the fibrocartilage which is forming the temporomandibular joint. Now, just like the head is actually related to the fibrous, cartilage, the fibrocartilage which is forming the temporomandibular joint, right? With obviously the temporal bone. So the neck is also partially covered up with that fibrocartilage. And there is another important structure which is related to the neck. That is, the neck is actually receiving insertion or attachment from the ligament of the temporomandibular joint. The ligament of temporomandibular joints attachment is also there along the neck, right? Another important thing which I would like to say is, see, when you see the anterior aspect of the neck of the condylar process, you will see that there is a depression, right? That depression is known as the pterygophobia. Pterygophobia, very important. Why? Because this pterygophobia is actually receiving the attachment of a muscle, that is the lower large head of the lateral pterygoid muscle. So we already talked about the medial pterygoid muscle. Where was it? Where was the medial pterygoid muscle there? Let me take out that place. Yes, the medial pterygoid muscle, just like I had said before, it was related to somewhat over here, right? That is inferior to the mandibular foramen, right? Whereas the lateral pterygoid muscle, that is attached to the pterygophobia, or rather it's not the lateral pterygoid as a whole, it's the lower large head of the lateral pterygoid muscle, which is actually attached to the pterygophobia, which is in turn a depression found on the neck of the condylar process. Done. Now, just one last relation you please do remember for me. Just one, all right? We have reached the medial part of the neck, right? We were viewing it from the lateral part. Now we are viewing it from the medial part. This medial part of the neck of the condylar process, this is actually related to what we call to be the auriculotemporal nerve. The auriculotemporal nerve is related to the medial part of the neck. Just this one you remember. All right. Now, let's get on with this one. This was what? Condylar process, and this is what? Coronoid process. The coronoid process, this is the anterior process. Now, do me a favor and embed this in your mind or heart, wherever you want. Coronoid process, whenever someone utters this, the first thing that should come to your mind is the name of a muscle. That muscle is temporalis. Temporalis. Whenever somebody says coronoid process of the mandible, immediately what strikes in your mind? Temporalis. Why? Firstly, because the apex of the coronoid process, the medial surface of the coronoid process, and a part of the lateral surface of the coronoid process, all of these structures, they are providing attachment to the temporalis muscle. First thing is that. Second thing is, the coronoid process itself is formed in the early stages of development of the mandible. It is itself, this coronoid process is itself formed due to pulling action of the temporalis muscle. We are not going into the details, but it would suffice to know that the pulling action of temporalis is what causes the formation of this process. Right? Right. So that is the coronoid process for you. Now let's talk about the last thing in, or rather about mandible, that is this, the mandibular angle. The mandibular angle is obviously the meeting point of this posterior border along with the base of the ramus. This is forming an angle. That is the mandibular angle. It is quite prominent. You can touch and feel your mandibular angle, right? Kindly do that for me right now. Okay? Did it? Okay. Now, listen to me carefully. This mandibular angle is not a mere landmark of the body. It is not a mere surface landmark. It has other implications as well. What is that implication? See, this angle, it is obtuse, right? In adults, it has been found that the mandibular angle is close to 110 or 120 degrees. All right, in adults. But in neonates, in the newborn and the elderly people, this angle is much more obtuse. That is about 140 degrees, right? So this is a very important criteria for determining the age of a mandible or the age of an individual. Not only is the mandibular angle the criteria for determining age of a mandible, but like I had said, the mandibular, or rather, I'm sorry, the mental foramen, this is also a very important structure which helps in determining the age of a mandible. Listen to me carefully. This mental foramen, in case of adults and also in case of this model, if you look carefully, it is kind of in the midway between the alveolar border and the base of the mandible. It is kind of in the midway, right? However, in case of elderly people, this mental foramen is closer to the alveolar border because there is erosion of the teeth and jaw sockets, right? So what happens is that the more this part gets eroded, this part gets closer to the alveolar border. Whereas in children or neonates, this is closer to the base. This mental foramen. So very important criteria, mandibular angle and this thing, that is the mental foramen. The last criteria for determining age of a mandible is these processes, that is anteriorly the coronoid process and posteriorly the condylar process. Look at the model here. It's very easily understood that these two processes are approximately at the same height. They are the same line, right? However, it has been found that in neonates, the upper limit of the coronoid process is higher. The upper limit is higher. It is actually higher to the condylar process upper border, upper limit. So that is also an important criteria for determining the age of an individual. So I feel like we have covered the mandible fair enough. Next time we will be dealing with more complex bones. I know if you felt complex with this bone, I know studying it for the first time it might be a little bit puzzling, but as you go on with more and more bones and more structures related to the head and neck, and you get familiarized with the ecosystem of the head and neck, just you have gotten familiarized with the other abdominal regions of the body, just like that, once you start getting familiarized, it's quite easy. So all right, that's it for now. Thank you.